I hope that this step-by-step training for the application as well as the website, the login-based website would be beneficial for everybody, and we would be very happy to see any feedback that comes from the ground when you actually start using the application, and we like to improve our application by your feedback. Uh, uh, our Microsite team has also joined us. I see Shobhik, Hardik, Anjali, Kunal, and the developers of the Microsite applications also joined. So I think they are going to lead us through this application that we developed. And now we hope that all the field level work is going to happen on the app. We are hoping that from 16th of January, from 16th of January, we do all the work of Microsite. Can I ask Miss Mukta Arora to mute her mic? She doesn't want to. Mukta Arora from Wish Foundation. Thank you so much. So I was saying that we are hoping that from 15th of August or 16th of January, we do all the work of Microsite on this Microsite application itself, so that we are able to feed in more data for the public dashboard that is also aligned with the Microsite application. And this Microsite application, intentionally we have not published it on the Play Stores and iOS application, iOS store, and we are going to provide this application as a APK file to the relevant stakeholders, so that because it is a very close knit community who is going to use this. And let me again congratulate my Microsoft team and the developer team to develop this application. And I hope that this training would be a success, and everybody, we are open to all kind of feedback that may come from you. Thank you so much. I'll hand it over to Shobhit and Kunal to take this forward.
Thank Thank you, sir. So I again welcome all the participants in today's training. Um, Together, we are the entire team of Microsite, including the team which has developed this application and dashboard. Uh, all of them have joined here today, led by Kunal Arora, who was leading the team which developed this application and dashboard, along with the three YEPs and senior software engineer Mohit, the three YPs who actually made the major effort in developing this application and dashboard, Mr. Sarvesh, Mr. Dev Nirmalya, and Mr. Vinay. All three are available today. So we want that in case there are any issues, there are any matters with which we are unable to answer, they can sort of chip in and help us in resolving the issues. And again, it's a simple disclaimer that today is the first trainers that we are organizing for this application and dashboard. There might be some issues, some problems may come in, but that is the role that the support that we want from our development partners and state teams. If at all you find any issues in the application and the dashboard, let us know. There's still time, a week's time before we actually go live and start updating the data on the live dashboard. So before that, please test the application. We'll be sharing the links of the application. We'll be sharing the link of the dashboard. You can sort of train your teams, work on it, test it, and then see if at all you face any issues, any problems, any improvement that you want, and then we'll have a forum where we'll be able to interact with each other, and with your suggestions, we'll be able to make it better. It will be a journey that we'll be starting from today, and I hope that this will fulfill all the expectations that we have in order to uh, implement the microsite program better. So, without wasting much time, just wanted to make sure that we have representation from all the concerned stakeholders who are expected to join today. I think we have the state list where whom we had requested to join today. I think we have representation from Goa.
Yes, sir.
Okay, so Goa team is there. Andhra Pradesh, do we have any representation from Andhra Pradesh?
Hi, we are from Yes, sir.
Okay. Chhattisgarh.
Hello, am I audible?
Yes, yes, you're audible.
Yeah, we are from Andhra Pradesh ABD.
Okay, okay. Gujarat. Okay, we are yet to have somebody from Gujarat, so we can call the Gujarat team, please. Someone from Maharashtra.
Hello.
Yes. Hello.
Hello.
Yeah.
Yeah, me and Hussein are from Maharashtra. We are part of Wish Foundation, working as a development agency.
Okay. Yeah. That's fine. I mean, do we have somebody from the state team? I'll come to the development partners later. Okay. So moving on to other states, do we have somebody from Manipur?
Yes, sir. Dr. Zone, me, and my project manager, Ramesh Konsam, is there, sir, from ABDM
Okay.
Manipur.
Yeah. Thank you. Mizoram, I think we had JD sir.
Yes, yes.
Okay. Uttar Pradesh. Someone from Bihar.
Yes, I think Bihar team is available here with the development partner and interfacing agency and the ABTM team. Mhm.
Okay. And lastly, someone, do we have someone from Chandigarh and Punjab?
Hello, I'm here, sir, Dr. Subodh. I'm from Chandigarh, ABDM team.
Okay. Welcome, Dr. Subodh. Anyone from Punjab?
Yes, sir. This is Romit here from Punjab team.
Okay. Welcome, Romit. So now we'll move on to the development partners. So Path team, do we have somebody representing Path?
Yes, sir. Dr. Saurabh and Pooja here. Am I
Great.
audible now?
Chai?
Yeah, sir. This
Yes.
is Dr. Saurabh and Pooja from Path.
Hi, this is Utkarsha from WGCF.
Wish Foundation. So we've already somebody has confirmed from Wish Foundation.
Hi, this is Dr. Gauri from PATH team, leading ABDM in Maharashtra and Goa.
Hi,
Great, Dr.
other than the state team for which Neonica and myself, Dr. Prajna, we joined from NHG.
Okay. Do we have somebody from Piramal?
Yes, we Anvesh here with the team. Yeah.
And IIC team?
Yeah, hi, this is Tableen. We're currently working in Chandigarh. Just a small clarification also. Dr. Subodh, who is with us, he's a part of the field team. He's managing the field team from Doctors for You for implementation here in Chandigarh.
Hi, I am Vikas, working with IIC's UP team as a development partner.
Okay, so now that uh, most of us are already joined, so let's start the training that we have today. Very briefly, I'll cover the overall structure of both these application and the dashboard that we have, and then Dr. Anjali will conduct the training, and we'll request all our participants, please keep on asking your queries, and the TOT, because both the application and dashboard are pretty user friendly, so the training per se part will be very short, and majority part would be your understanding of it and your queries. So we are more interested in listening to your queries and answering them. That is why we have the whole team which has worked on this here together. So the major part would be your queries, so please feel free to ask any question, any queries. Very briefly, what we have today uh, is point 2 and 3. Point number 1, national public dashboard is still under development, but very soon, within a week, maybe we'll have a public dashboard where anyone, just today, in today's date, if you can see the performance of ABDM on our public dashboard, likewise for microsites as well, you'll be able to see the performance of each and every microsite till the base level on that public dashboard. Very soon we'll have. Is still under development. Some minor corrections and details are being worked out, but very soon it will be available. Then the second part, country, state, and district specific dashboard. These will be the internal dashboard where the performance would be visible, and then some functionalities would also be attached with these dashboard. These are these will be provided to a person or the team specific to country level, state level, and the microsite level. So at these three level, there will be a web-based a dashboard which has already been created. Today, we'll explain you more about it. We'll give you some credentials so that you can start using those credentials on the test test versions, and then see for yourself what facilities, what benefits it can give you. So these dashboard will allow for a state dashboard, it will allow you to create facilities for create microsites, because state will be managing multiple microsites at one go. So state will have that control over creating more microsites and then later on. So that is the second part, and third and important part is the data entry application that we have created. This application will be used by our field staff who will be working in field and updating their performance in real time through this application. So if at all a person is visiting 10 health facilities in a day, they can update that, okay, I visited facility A, B, C, D, E, F, G, H, and then they can also in undeniable way, they can confirm that they were actually there, because their locations will also be recorded through this application. So that way, this application would be very useful to report the real-time performance of the staff, so that the public dashboard will be updated in real time. What is the progress in microsites across the country? And second is that the Microsite team will be able to sort of monitor their staff regularly, whether or not they are actually doing the job that they are telling us. And if at all you want to make any changes in the way they are working, how they are working, all the data sets, all the reports would be available at single clicks. So this is in nutshell what we are going to sort of present before you today. Country dashboard will have the functionality to track the progress of different states, create user. So country dashboard would create user for the state level. So state admins would be created by country dashboard. So today when we have so many state teams here, we'll start with the state dashboard, because country dashboard, country level logins and password would be managed at the NHL level. For each state who will be coming up with a microsite or who have already initiated microsite, will create a user login and password for them. That is where the whole program will start with regarding the dashboard. You will have a credential, you will log into the state dashboard, you will see the performance. In order to initiate a microsite in your state, you will have to create a user for microsite level, and then the microsites will create their own users. So for a state, you will have the functionality of creating microsites in a state and creating users at the district admin level. Similarly, the district specific dashboard, they will have the functionality to track the progress of individual microsites and field officers, and they will also be able to add entities like facilities and professionals. One important functionality that we have in the district specific dashboard, microsite specific dashboard rather, would be to bulk upload the number of health facilities, because we understand there might be multiple ways through which you may get different lists of facilities. So bulk upload would be a very important functionality that has been provided to the microsite level teams. Please understand that there will be a larger set of health facilities where the teams would be working, and then there will be a smaller subset of it on whom the registration part will happen. The HFR registration and HFID would be generated. So overall, the larger subset would be the list of health facilities, the entire universe that will be mapped in the mapping exercise. So for that purpose, bulk upload of health facilities would be a very important part. Then the data entry application, as I've already mentioned, it will play the dual role of reporting and monitoring. For reporting, we can add HP IDs and facility IDs. Then facilities and health professionals, they will also be able to add. They can view their own progress so that they can understand what is left and what needs to be done at the priority. Then adding visits to a facility or professionals, all these functionalities have been provided. Then for the monitoring purpose, the microsite team will have that benefit through this app, that they can actually ensure that the staff has visited the actual location of the facility, and real-time data of all work done by their field staff will also be available through this application. So in a very short, I just wanted to let you know about the two functionalities that we have prepared, the dashboard and the application. And now to take you further, one by one, we'll explain the functionalities of this dashboard. And Dr. Anjali Thakur, she has worked on both this dashboard and applications. So she will take you through these dashboards and explain the functions and what you can do through them. Over to Dr. Anjali.
Hi, good afternoon all. A very warm good afternoon to all on this cold winter day. So I'm going to share my screen. So as Dr. Shobit has already told us, let's start with the state login. So for the state logins, the credentials will be shared with the state officials through their email. So I have already created a username and password for the state of UP. So
this screen is not
Hello, the screen is not visible. I'm currently seeing PPT.
पूरे स्क्रीन करो.
Is it visible now?
Yes.
Yes, ma'am.
Yes.
Okay. So let's start. So I have already created the login credentials for the state of UP. You have to enter the CAPTCHA. So this is the state admin dashboard for the state of Uttar Pradesh. You can see here it is written Uttar Pradesh and name of the user. I have created the this login for Mohit sir. And here you can see how many microsites are active for UP. Here I have only created 2 till now. And there is a filter for microsites here, Lucknow and Kanpur. So on the left side, you can see there are 4 options. First, the dashboard. Second, progress report, add entity and my profile. So let's take these one by one. On the dashboard, these 4 boxes you can see, these are the targets of the microsite. Health facilities, health professionals, facilities using ABDM enabled software and ABHA linked health records. So on the basis of these, the interfacing agency is going to get the funds. Here in the blue, you can see the mapped facilities. In the health professionals, mapped professionals. This is the target facilities and target professionals, which is like defining the universe of the microsite. Out of the mapped facilities, in the approach column, you can see the facilities which the field officer from the interfacing agency has visited. And out of the visited facilities, out of the approach, how many of them field officer have onboarded onto the ABDM ecosystem? That is, they have created the HFIDs, and for the health professionals, they have created the HPIDs. And out of the registered, how many of them are verified by the council verifiers for the professionals and by the state verifiers for health facilities? Similarly, the third target, that is facilities using ABDM enabled software. And how many of the facilities are then creating ABHA linked health records? So the interfacing agencies are only going to get the funds on this verified number, verified HFR and verified HPR, and these ABHA linked health record and facilities using ABDM enabled software based on the phases that we have mentioned in the operational guidelines. In this table below, you can see the detailed view of the microsites which are active in the state of UP. So here we already have Lucknow and Kanpur, and we can see the progress of the components, health facilities, health professionals, which are approached and registered in these microsites. And we can see the progress in the last week. We can see the progress weekly wise and month wise. Yeah, this is dummy data. We are doing this on the sandbox, and you can also download the report from here. So this is all about the dashboard of the state admin. You can also filter out microsite from here. Let's see, let's select Lucknow, and the whole statistics will change to the Lucknow. Similarly, for the reports, you can see the progress of the Uttar Pradesh, how many facilities they have approached, how many got registered, and finally the verified HFR, verified HPR, how many facilities onboarded HMIS and health record link from these facilities. This you can get in last week, in weekly wise, monthly wise, and in the last week. And we have these bar diagrams of the verification status of HFR and HPR. This is important for the state, because this is the work of the state and council verifiers to verify the HPIDs and HFIDs created. Now, the most important part of this state admin is add entity. In add entity, there are 2 functionalities. First, the state admin has to create microsites and user for the microsite. Add microsite, for example, let's take the example of UP. There are 35 microsites that UP is going to start. So the UP admin has to create 35 microsites. For Punjab, there are 2 microsites. So Punjab is going to create a microsite for Amritsar and Patiala. So here you can see there are already 2 microsites active in Uttar Pradesh. So let's create one more, add microsite. You can write the name of microsite here.
Varanasi.
Varanasi, thank you, sir. Varanasi, implementation agency, I guess HLF PPT is there. This is a
Piramal.
sandbox. You can change this. Let's say it's Piramal. District is Varanasi. Let's submit this. And you can see microsite has been added successfully here. Now for this microsite Varanasi, we have to create a district admin or the microsite admin. So we'll go to the add user. Currently, there are two microsite admins, one for Lucknow and one for Kanpur. Let's create a district admin for Varanasi. So we'll go to add user. We'll add the name of the user. Let's say name is Varanasi user. Mobile number. I'm adding this. User type is I'm creating user for district admin for Varanasi. Username is Varanasi admin. So I'm creating the same password. Designation, he is the manager of this microsite. The microsite is now in the drop down. You can see this is giving me three options: Lucknow, Kanpur, and Varanasi, because I have created only 3 microsites yet. So now I'll add microsite here. Implementation agency, development partner, state, district. It has auto populated. Let's submit. And you can see Varanasi user, district admin, manager is added in this. There is a last option of my profile. From here, you can change the password. As I have already told, the login credential for state admin will be shared via email, and from here, state admins can change their password. And this is log out. Till now, any doubts?
So in the current system, do we have only two type of users, admin and state, which has a view only access?
Sorry, you are not clear.
Okay, so when we created the user, we saw that there is two types of users, like the one is admin and another is view access.
So there are two type of users. In add user, you can create two type of users. One is like state admin will create a login for the state admin, and one for the state view. So state view will be for the other state officials who cannot add user or microsite. They can only view the progress.
Okay, fine.
I will create one user for, so name is, let's say user. So from here, this is state view. User name is UP view. He is the state nodal officer and state is Uttar Pradesh. Let's submit. Okay, so now this user has been added here. So let's log in from these two login credentials. Let's log out from here. Now we'll log in to the district microsite admin for Varanasi. So now you can see this is the district admin for Varanasi, for user Varanasi user. Here you can see the progress of the field officer working in this microsite Varanasi. So currently there are no field users. And in the left side, there the options are same: dashboard, progress report, add entity, and my profile. Dashboard, you can see these four are the similar targets: mapped, approach, registered, verified HFR, approach, registered, verified HPR, and ABDM enabled software using facilities, and ABA linked health record. So let's start with add entity so that it will be reflected on the dashboard. First, we'll add user. Currently, there is no user for this microsite. There is no field officer for this microsite. So I'll create mine, Anjali 145. I'm a field officer for Varanasi. So here you can see a prompt here. Please communicate to the field officer. Username and password is her mobile number. So whatever mobile number you are going to enter here is going to be the username and password for the field officer. So yeah, by default. And district admin or the microsite admin is going to have the list of field officer working in their microsite. So you can see microsite, implementation agency, development partner, all these are auto-populated. Let's submit. And you can see one field officer has been added in this. So let's see if it is reflected in the dashboard. Here you can see the staff, Anjali, and the targets, the progress of this field user. And similarly, you can...
I have one question, Anil from Piramal, UP. So who will be the field officer?
Field officer will be from the interfacing agency who are going to
Okay,
work.
okay. Yeah, got it. Thank you.
Field officer or field executives.
Okay. Yeah, yeah.
So you can see the progress in the last week, monthly or weekly basis. Now we have added one user. Similarly, for the user, we can also create a district view from district admin. One was for the field officer and one is for the district view. So let's create district view. Name is user type is district view. So he cannot create field officers or add facility or approve facility. He can only view the progress of this Varanasi microsite. We will also log in from this district view so that we can see. And is the now you can see it has also been added here, district view. So another functionality that is there on the district admin is add facility. So district admin is also going to add a facility in this particular microsite. Here we have two functionalities. Either he can add individually single facility or bulk upload. So let's add. So here we have an option like if the health facility IDs has been already created, you can click on yes, and you have to enter the facility ID here. Or you can create. This is the test one facility name. Facility manager is test manager 1. Phone number is facility address. I'll add this. Facility type, if it is a hospital, standalone clinic or lab. If this facility is ABDM enabled, no, yes, whatever it is. Added by, so here, so in added by, you can see there is, it is only showing Anjali because we have only added one field user here. So now we'll submit, and one facility will be added here. So in this facility, you have to add healthcare professionals. So from here, add professionals. Currently, there are no professionals. You will add professionals. Similar to the health facility ID, if it has been created or not. So no, professional name is test professional. Professional phone number. What is the type of the professional? Doctor or nurse? What is the subcategory? Dentistry. Facility name. So now in the drop down, you can see only one facility, that is test one, that we have created. So first you have to create the user, then you have to create the facility, and then the professionals. And it is added by Anjali. So the practitioner has been added successfully here. This my profile is same. You can change the password here and then log out. So any doubts on the district admin login?
Anjali,
Yes, sir.
yes, I have a question. Regarding that facility and professionals manually created from this portal, will that be reflected in this MBDM XPR in the chapter?
Sir, you are not clearly audible. Can you please type or say it again?
Okay, yeah, what I'm asking is that just now we have created this test professional, right? Manually from
Yes.
here. Will this be reflected in HPR, in this ABDM HPR? Yeah, same thing for that facility you have created in from that ad facility.
The health facility that I have created and this test professional, will
Yes.
it be
Yes,
reflected on the
HFR.
ABDM dashboard?
Yes, in ABDM HPR and HFR.
Yes, if it already have the HP ID and HF ID, then it will be reflected on the dashboard.
No, suppose they don't have the ID right now, not just like you have created this. So when to add, when will they receive the HP ID, or do you have to register this as the same as other professionals and facilities in HFR and HPR?
Sir, both this application and dashboard will have no functionality regarding creating HTID or facility ID. The existing applications, existing portals, they will continue to, field officer will have to use those facilities to create HTIDs and facility IDs. We have created only a reporting tool. So when you create, you discuss with the facility owner, you convince them, they agreed to create a facility ID for themselves. You undertook the registration process on the portal, and the facility ID is created. Now you will report only the facility ID here. We will show that whether their facility ID is verified or not, and what is the total count of such facilities added by the microsite. This is the purpose of the dashboard and application. It will not create the HPID or facility ID. The staff will have to use the existing portals and applications.
Okay, noted.
Okay,
Field
I have a
officer.
question.
Hello, ma'am.
Give
Hello,
them
ma'am.
the HPID and HFID so that they can enter this on the data entry application.
Ma'am, one query. May I submit my query, ma'am? I'm from Manipur,
Yes,
ma'am.
sir. Yeah,
Ma'am,
sir.
ma'am, regarding the health facility registry, in the dashboard which you have shown, ma'am, there is already whether if the facility is already registered or not. If it is registered, there is facility ID entry is there, ma'am, in the health facility which you have shown in this one microsite dashboard. But the health professional registry, if the person who is already a doctor and who is already registered in the in our evidence platform already registered. But for the SPR registration, though, there is no question asked like if it is already registered in HPR or not. No question is asked, ma'am. So here my question is like just related with the previous query. I just want to add on in the dashboard, state admin dashboard, health facility approach, health facility registered, health facility verified is there, and also for the same health professional, health professional approach, health professional registered, and health professional verified is there. So, ma'am, and there is, when you saw the entry point in the dashboard for the health professional registry, there were no place to put health professional ID in the system. So, ma'am, my query is there. Thank you, ma'am.
That's a very logical question, sir. The thing is, this is only a microsite level tool to manage the staff. This is the web-based tool. Actual reporting will happen through the application. We are here to show you the application, the facility to enter HPID, facility ID, visit facilities. Everything is part of the application that we won't demonstrate. Currently, this is the microsite manager, like the main head of the microsite. That person will be sitting at the district headquarters and managing his or her team. That person will use this web interface to create login IDs and to monitor the performance of their team. The sole function of this web interface for microsite team is this. The entire reporting will be done on the application, the mobile application.
Thank you, sir. I got it. Thank you, sir. Thank you.
Ma'am, I have a question. Hello.
Anji.
Ma'am, whether the end user, the facility which we are going to add in this portal, whether they can also check their report through this ABDM dashboard, a microsite dashboard.
No, facility is not. Only the people who will have the login credentials for this dashboard, only they will be able to see. See, this is the difference between the public dashboard that we are building and this is the internal dashboard. So this
This is not
dashboard will only
visible,
be
I think, very equal.
Sorry?
Okay. Voice is not clear and it is.
Hello, am I audible?
The voice is echoing a lot, I think. You can come near to the mic.
Okay, ma'am. I hope I'm audible now. So what I'm saying is this dashboard, this is an internal dashboard. This will be available only for
You're not audible, sir. Hello. Are we audible now?
No, yes, you are audible.
Yeah, now you're
better.
audible. Okay.
what I'm saying is that the dashboard that we are currently displaying before you is an internal dashboard. It will only be available to the
Sorry,
person who will have the login credentials.
Anjali, while your voice is clear, Shobit's voice is not clear.
Yes. How is this possible?
Okay, I hope now it's better.
Yes, much better.
Okay. So this is an internal dashboard. Uh, this dashboard would be available for only those people who will have the login credentials, which essentially would be the state teams, microsite teams only. Nobody else will have access to this. The public dashboard that we are building, that will be open to entire public, to the hospitals, to facilities, the professionals, everybody. So they can see what is happening in their microsite regarding their own health facilities, if possible, all those details would be visible on the public dashboard for them. Currently, the dashboard that we are displaying, it's only for the internal teams, state teams, microsite teams.
I have a question here. Is there a way that I can update HFR ID or HPR ID in this portal? Second question is, we are adding facilities and the professional IDs. So is there a sequence that needs to be followed for adding them, or we can add independent of each other?
So again, I'd like to reiterate, this is currently we are showing you only the microsite level web interface. Actual reporting will display how that will be done through the application, because the field officer will be doing it. Before wasting much time, I'll request Anjali to next show the application first. Then only maybe it will be clear in everybody's mind. Just wanted to mention two broad points. One, neither the application nor this dashboard both will not provide the facility to create HFIDs and HPIDs. That facility will still be available on the existing portals and applications where one can create HPIDs, HFIDs. Those details we will share later on, but neither the application nor the dashboard will do that. It will only be a medium through which you can report. If you have created something along with the facility owner or the professional owner, HPIDs has been created or facility ID has been created, you have to report it here so that we know what work you did. We are not going to do the registration. This app will not help you in registering. So please make it clear. And okay. And the second point that second point we have already mentioned. No? Okay. So without wasting much time, I think we should go ahead with the application first.
I had a question, if I may quickly. Hello.
Yeah.
Yes, you were asking something.
Okay. In case where one health professional is associated with multiple facilities, how is that going to be entered in the application? Does it follow the same method, or is there a different way?
So let me show you on the data entry application, this thing. We are sharing the screen. Wait a sec. So this is Microsite data entry application. And this is the login page for the field officers. So from the Varanasi microsite, I have created user name and password. I'll enter the username, which is going to be the phone number of the field officer. Let me reshare my screen. There is some network connection issue.
So in between, I have one question that in the test ID it was showing the HP ID null. So why it was?
Because I didn't enter HPID.
Okay.
Yes. If you have the HPID or HFID, you can enter the HFID and it will appear on that screen, on the dashboard.
Yeah,
So
got
I
it.
guess
Thank
now the screen is visible.
you. Got it.
We'll log in. So for the data entry application, first you have to change the password. An OTP will be shared on your number. And now you have to enter the new password. So this is, now you can see a small dashboard we have created for the field users so that they can track their progress. Here you can see first professionals, then facilities. Similarly, this was on the dashboard. Here also we have mapped, then approached, registered and verified. And these are clickable. If you click on the approached, you will have the list of the approach professionals and approach facilities also. You have to search here. Currently there are no professionals or facilities. We'll enter. And in the search, you can search the facility from its name or the facility ID. So let's search for ABC. So here it is showing we cannot find any result. So let's take a scenario that field officer has gone to the field and he has found a hospital in his mapping exercise. So he has searched the facility if it has already if it is already present in the ABDM ecosystem, but it's not, so he's going to add this facility. So in his first visit, the doctor did not agree to create the facility ID. So facility ID not created. The name of the facility is ABC Hospital. Name of the manager is ABC Manager. If this facility is using some HMIS, ABDM enabled HMIS, let's say no, or you can say yes. Then facility phone number. If the facility is already using HMIS, then you can click on yes and you can enter the name of the HMIS, right? And the address of the facility. I'm entering a dummy address. The type of this facility, is it a hospital or a laboratory, standalone clinics? And how many professionals are working in this hospital? Let's say 2. So now you are going to add professionals in this facility. Let's say it's a lab and there are good professionals, doctors or nurses in this facility. So you will enter 0 and you can directly submit this form. Let me show you the flow. Let's say there are 2 professionals in this and now you will add the professionals here. If the HPID is already created, you can go to yes or no. Let's take no first. Name of the professional is XYZ. Healthcare professional phone number. He's a doctor or a nurse. Let's say he's a doctor from a modern medicine. And let's submit this. So here you can see one facility has been added, ABC Hospital with address and phone number of the facility manager. And in the professionals, you can see XYZ doctor is there with his phone number. Now, as we have entered, there are 2 health professionals in this facility. Let's add one more. And in this, for this, the HPID has been created. So let's enter HPID. Once you have entered the HPID, you have to go to search, and this will in real time will search from the ABDM dashboard, from the ABDM ecosystem if this HPID exists. So here you can see the name of the professional, honey, the professional category, and subcategory already auto-populated. Now you only have to enter the name, phone number of the professional, and you will submit. Now in this page, you can see 2 professionals has been added, one XYZ and another honey with the HPID. Now we'll go to the home page, and you can see 3 professionals have been mapped and 2 facilities. Now let's search this the facilities we have entered. ABC. You can see this is when the field officer is going to for his second or third visit, he can directly search from here. He can either search from the facility name or by the facility ID. So let's search from the ABC. You can see ABC hospital is there. View facility. Now this time the doctor agreed to create his HFID. Let's enter the HFID. You have to search, and this will search from the ABDM database if this facility. So now you can see this facility has already been created, NSDLE Gov test facility. You have to enter the phone number. And now the field officers have to add visit. You have to click on the add visit. It will take your location. So for which health professional you are going to add the visit. So we have 2 professionals in this health facility, XYZ and honey. So let's add this visit for XYZ and confirm. So now you can see your visit has been added, and let's submit this form. Confirm. So we have taken the right HFID. So it's saying that this HFID already exists. Now you can see the facility details with the HFID. Let's go to the home page, and you can see the visit has been added in the approach. Now you can see the field officer has approached 1 facility and 1 professional. Any doubts on this? Right now we have in professionals 1 approach professional, 0 registered and verified 0. So let's search for this facility. So here you can see this Balayush view facility. Here health facility ID is there, facility name is there. We cannot edit this now because this is from the ABDM database. Now let's go to add visit. confirm your location. And we know there are two professionals in this. Let's add a visit in this professional, Honey. Confirm and submit. Go to home page. Now you can see in approached, the number has changed to 2. So this is how we are going to track the process of the progress of the microsite and the work of the field officers. This is all about the data entry application. If you have any questions.
Ma'am, actually, we have a pharmacy registered over ABDM. HFR has been created and HPR ID has been created. Can we just show it on how can we add that member to the microsite dashboard? Actually, ma'am, I just have a question that whether it will ask for OTP or not while registering a user.
User as in from the health professionals?
Ma'am, we have to first of all register a facility over there.
Yes.
Actually, ma'am, we have I have the facility ID, the HPR ID, and the password for it. Can we add add the system, add the user in this going on process?
So definitely you can do that, and but I would advise that considering that we are not sharing any facility ID and HP ID with anyone, these are private data. So I'll request not to do that. We can connect one on one. I mean, I'll suggest that you watch the training and we share the link with you, and you do it at your own pace. And if at all there is any issue, you let us know. And I'll request all other participants as well. We have made both XP and facility ID a personal data. So please don't share it with anyone, because on that basis only the whole microsite and the related milestones and the related the funds that are being released. Everything depends on that. So let's not share it on any private any public platform. Regarding your issue, again I'll clarify that you don't need any password, you don't need any OTP. This is only a reporting tool. Our field officer is going on field. That field officer is meeting multiple health facilities, meeting multiple health professionals, telling them about the benefits of APDM. Some of those facilities, some of those doctors, health professionals would agree to join the process of APDM, to register for HFR, to register for HPR. Our team members, the same field officer will facilitate the whole HPR and HFR process by telling them which portal to go to, how to register, and once their registration is complete, they will come out with some facility ID or health professional ID, HP ID. Those HP IDs that you'll have to enter here so that we can understand how much work is being done by that particular microsite field team. Please understand, this is only a reporting tool. You don't need any OTPs here. OTP is only for to ensure that the field member who is using their logins, they are actually using this. No other person who is not part of the team is using it. That's the only login part is associated with OTP. Other than that, for any entries, you don't need any OTP or password.
Okay, sir. Sir, one more question. Sir, whether when these test user and they are being created over there, so they can be deleted or replaced as per the admin's wish.
17,222 पैसे दे 17,222 रुपए
सर एक्चुअली क्वेश्चन ये था कि सर जैसे मान लीजिए अभी हम लोगों ने टेस्ट फैसिलिटीज और टेस्ट आईडीज वगैरह ये सब बनाई है सर, आगे चल के ये वो हो सकते हैं जैसे जैसे सर काफी सारी जगह पे होता है कि एडिटेबल नहीं होता।
This is a test environment, so here everything is allowed to be deleted. But I mean, after you enter, because these are like HPIDs, facility IDs, these are pretty important details basis which the entire work will happen. So we don't directly allow कि अभी आपने enter किया फिर आधे घंटे बाद delete कर दिया फिर enter किया delete किया. That cannot be done. If at all anything needs to be deleted, you'll have to contact the admin team, the backend team of this dashboard. That is, you'll have to inform NHA and we'll facilitate that process only and only if we consider that the case is genuine. Otherwise, deletion is something that has not been allowed. That is why the system gives you multiple prompts कि अभी आप देख लो सब कुछ ठीक है कि नहीं, and then only you confirm. And very basic details are we asking. We are not asking much. We are only asking कि आप एक बार HPID एंटर करो, उसके बाद सिस्टम खुद ही आपको सारा परफॉर्मेंस दिखाता रहेगा कि टीम ने टोटल कितने HPID एंटर किए, HPID से HPR बना कि नहीं बना, वेरीफाई हुआ कि नहीं हुआ. Everything would be shown automatically. All you have to do is enter the HPID once. एक ही बार HPID एंटर करना है. That time you have to be a bit careful. और अगर कभी रेयर केस में गलती हो जाती है, देन द टीम द स्टेट टीम आपको उनको इन्फॉर्म करना होगा, माइक्रोसाइट टीम विल लेट देम नो एंड उनको कॉपी में रखते हुए आप एनएचए को रिक्वेस्ट करोगे तो हम अपनी बैकएंड टीम से उसको डिलीट कराने की रिक्वेस्ट करेंगे. द प्रोसेस वुड बी डिफिकल्ट टू डिलीट क्योंकि वो हम प्रमोट नहीं करना चाहते कि आप ऐड करो और डिलीट करो, ये वाला प्रोसेस हम प्रमोट नहीं कर रहे.
जी सर, ओके, थैंक यू सर.
डॉक्टर सौरभ.
Yes, first of all, thank you for the demo and congratulations to the whole Microsite team. I would just like to add a small suggestion. Looking at all the queries, if NHA and the Microsite team could provide a digital handbook of the application and the web-based tool or a flow diagram for adding multi facilities for a single as the question was asked. So a flow diagram or a digital handbook, it can be provided. It would be a great help for the training as well ahead.
Thank you, Dr. Saurav, for your suggestions. We have already created the user manual for the dashboard and for the data entry application. So here in this application, you can see user manual is here. So if the field officer is stuck anywhere, he can open this user manual and download it from here.
Great, that
We have
helps.
given this on the data entry application only.
Okay, thank you.
Anjali, I have a small query here. Hello. Hello, Anjali.
Sharon, your voice is not audible.
Now, so I have a small query regarding the bulk entry option for the admin.
Yeah, say.
I just wanted to know about the bulk upload option for the admin.
Okay, you want me to?
Karan, the bulk entry option would be available for the web-based dashboard that will be handled by the microsite manager. That will bulk upload will not be available for the application. So we have request Anjali to show the district dashboard login and then show the bulk upload facilities.
Yeah, I was asking for the district admin.
So here we have given a template in which you have to upload the file. You have to download the template, this template. Right. So I have one sheet already. I'll choose that file, bulk upload. We don't have many entries there. Declaration and then submit. So this is the template for the bulk upload. So we don't have facilities. Let's add one. ABC, DEF manager. Facility type is hospital.
Excel sheet is not visible.
Can you please show the template?
I'll share it again.
स्क्रीन पूरी शेयर हाँ इसी पे ओके शेयर करो अरे शेयर कर दो बार बार थोड़ी एक चेंज थोड़ा ना करेगा इस स्क्रीन शेयर करो हाँ इससे क्लिक करो नाउ शेयर अभी एक्सेल लिखना है
Downloads. Submit. So here you can see, although we have only one facility in the bulk upload, but this is how it's done. And you can also see Bell Ayush is reflecting here that we entered from the application. With the HFID. Charan, is that okay?
Yeah, got it, Anjali. Thanks.
Am I audible, Charan?
Yeah, got it. Thank you.
आप देखो
चरण
If anyone can confirm, are we audible from an HA side?
Yes. Yes, you are audible.
Okay. So I guess bulk upload is also done, and you can also see Bell Ayush facility that we added in the application. It's reflecting here. Okay. And here in the dashboard, you can see for Anjali health facility, professionals approach has gone to 2 and registered health facility is 1 and professionals 1.
So in the bulk upload, we don't see the GPS coordinates capturing, I think.
Let's upload. The visit is not marked, so that's why.
See, GPS coordinates that we'll have to understand. GPS coordinate will be needed in case the user is saying, the field officer is saying that I have visited that facility. Currently, the bulk upload will add to the number of total universe. Like mapping has been done to for 500 health facilities, so that 500 facility list will be added through bulk upload. But slowly, one by
Okay.
one, the field officers would start visiting those facilities. First visit, they will mark the location of that facility, and then first visit onwards, they'll have to be within the 100 meters of that location whenever they are marking a visit to that facility. Whenever that facility is registered on HFR and they enter the HFID, thereafter the location that has been marked in the HFR registration, that location will be automatically fetched by the system, and further visits by the field officer, they will have to be in the vicinity of that location which has been registered in the HFR. So this is how we have created that mechanism to mark the geolocation of the facilities.
Yeah, yeah, got it. Thank you. Thank you.
Any more questions?
Hello, ma'am. Ma'am, I would like to ask a query regarding visits with your permission, ma'am.
Yes, sir.
Yes, ma'am. Ma'am, suppose the microsite has already visited uh, at least five health facility, and they have already registered in HFR, those five by the microsite team already before the launch of this application. And already those HPR working in the health facilities also been registered by those microsite guys. So for them to reflect on the this microsite dashboard, if they decided to do a bulk upload, is it possible that those the tasks uploaded by them will be shown like a completed task or something like that for that five visited, which is already completed work, no, ma'am? Please clarify my doubts, ma'am. Thank you, ma'am.
If I'm not wrong, you are asking if the HFID and HPID has been already created for the facility and now you want to do the bulk upload.
Yes, ma'am. Yes, ma'am.
Yes, you can. So I will again show you the template. Here you have to enter the HFID. Is it visible?
Yes, ma'am.
HFID has already been created. Then you have to enter HFID in this bulk upload template, and you can bulk upload. It will reflect on the microsite dashboard.
Thank you, ma'am.
Test credentials with you all the application in the dashboard, and if you have any doubts or queries, we are to resolve.
क्योंकि हम लोग फैमिली सबको देते हैं तो सबसे में फैमिली सबके नाम पे हम नहीं हम लोग को नहीं वो सब नहीं होगा अच्छा ओके इसमें
So if there are no further questions, we can end this call here. and we will be sharing the test credentials with you all, with the state teams and the development partners, so that they can explore both the dashboards and the data entry application. And as the application and dashboard are in the initial stages, in the first 10-15 days, there are going to be queries, and we'll be happy to resolve those. Thank you.
Thank you.
Thank you.
Thank you, ma'am.
How can we get the recording?
We'll mail it to you, sir.
No, thank you. Thank you.
We also have a user manual for the dashboard and data entry application. We will also share that.
Yeah, that will be helpful. Thank you so much.
Okay, thank you.
Thank you.